So now we are covering the chapter 17 of local and humoral control of tissue blood flow. Okay. So many MCQs here. So first of all, this introduction, what says that tissue needs blood flow. You already know for what? For oxygen of they need oxygen, they need nutrition, they remove the excretory products. For all that, tissue need blood flow. But some special purpose also, like skin, the blood flow to the skin determines the heat loss from the body. ठीक है? Now the blood flow to the kidney determines the excretion rate. Okay, glomerular filtration rate depends on the affected by blood flow to the kidney. So this is a very easy, you will understand if you read. After this paragraph says variation in blood flow in different tissue. They have mentioned the table 17. Okay. So what this paragraph says that blood flow to every tissue in the body is different. Okay. Like just focus here in this table for a while. There is a lot of MCQ. Okay. Suppose you are asked that the maximum blood flow is to this organ. So you have to remember that number 1 is a liver. Look, ml per minute 1350. The maximum. Second number is kidney. Okay. Or you can see the percentage of cardiac output. So maximum percentage 27 goes to the liver, then to the kidney, then to the brain, and on number 4 it is a muscle and brain on number 3. Okay. But when you are asked, so maximum blood flow is to the liver. But when you ask on a specific area, ready? So ml per minute per 100 grams. So kidney is a very small organ, even though it is having a 22% of cardiac output. So it gets number 1. Ready? So as a whole organ, the liver is number 1. But when you are asking in per gram, okay, per 100 gram, per tissue weight. So kidney is getting like 360 ml per 100 gram. Well, liver, third part of kidney, only 95. Okay. As well as you say muscle, brain gets 50 ml per 100 gram and muscle only 4 gram. So the MCQ can be asked in such a way that the maximum blood flow to the tissue. Ready? So liver, but when the question is the maximum density of blood flow or टिश्यू वेट के हिसाब से अगर पूछा है तो डेफिनेटली द किडनी विल बी द नंबर 1 ऑर्गन. ओके, तो ये हो गया. सो दिस पैराग्राफ इज ओनली टॉकिंग अबाउट दैट द टिश्यू नीड डिटरमाइन द टिश्यू ब्लड फ्लो. So muscles are making about 30 to 40% body weight, but even though they are getting a very less amount of cardiac output. So now your question is here, this paragraph say why you have to regulate the blood flow, है ना. सबको ज्यादा ही दे दो तो बार बार रेगुलेट करना नहीं पड़े, पर that is this will be the out of the capacity of the heart. Okay, so that's why it is a very minutely regulated blood flow. So we give the blood flow to the minimal level that will supply the tissue's requirement, no more, no less, very accurately regulated blood flow. Ready? Why? To keep the workload of a heart minimum. Okay. So now we are talking about mechanism of blood flow control. Okay. So now there are two types: acute control and long-term control. So just it's a common sense. If you want to acutely, in a short time, you want to increase, you have to do vasodilation. Long term, है ना? Or you can decrease by vasoconstriction. But on long term, days, weeks, so which tissue is demanding more blood flow? There will be an increase in the size of the capillary, physical size and number of the capillary. ठीक है? तो उधर फिर वो capillary का anatomical changes होगा. Right? So this was acute and long term. Now this figure says if rate of metabolism increases 8 times, the blood flow increases 4 times. Okay, and if you decrease the arterial, this figure says you decrease the arterial oxygen saturation from 100 to 25, है ना. अगर ऑक्सीजन चौथे भाग का हो गया, so blood flow will again increase to 3 times. Ready? So okay. So So this paragraph is only saying that when there is a decrease in oxygen content in a tissue, the flow of blood is increasing. Okay. So this to figure and hold this paragraph only want to convey you this message. So please don't read it, don't waste the time. That when flow of oxygen is or concentration of oxygen is decreasing in tissue, the blood flow increases. Okay. So now there are two theories. Ready? For this acute local blood flow control. Okay. लोकल टिश्यू कंट्रोल के लिए हमारे पास दो थियरी है. कौन सी दो थियरी है? वन थियरी इज दैट वासोडाइलेटर थियरी. ओके, you relax the muscle by actively giving vasodilator substance like which this adenosine carbon dioxide है ना, adenosine phosphate, histamine, potassium and hydrogen ions. Lactic acid is also one of a vasodilator which will have a H plus है ना, hydrogen ions, and it will relax the muscles of vessels. Okay, lead to vasodilation. The second theory is oxygen depth theory. Okay, it says when tissue uses all the oxygen and there is a deficiency of oxygen, so muscles cells in a vessel wall or in a precapillary sphincter, okay, this muscle can't contract in a lack of oxygen, so there will be a passive relaxation. Okay, so there are two theory again. One theory are actively we are relaxing the muscle by giving them vasodilator, and second theory says that when there is a no oxygen, this precapillary sphincter, meta-arterial sphincter, okay, their muscle can't contract in lack of nutrition, oxygen and ATP, and automatically they, because they can't keep contraction, they will relax. Okay, so vessel will be dilated. Okay, so this two theory is explained starting from here. Ready? From this up to this. Okay, so how did they study this oxygen demand theory for local blood flow? By using bat, Camachidium, the bat wing. They're doing the study on precapillary sphincter on bat's wing. They said there is a cyclic opening and closing, okay, of this precapillary sphincter. Ready? This opening and closing depends on the oxygen concentration of tissue. Suppose this tissue has a good oxygen content. Ready? So the muscles also have, because of this tissue oxygen this muscle also have a good oxygen content from this area. So they will be contracting, the muscle will be contracting, the sphincter will be closed, so blood flow less. But as the tissue uses all the oxygen, there is also deficiency of oxygen here. So the muscle now not contracting, so sphincter is relaxing and blood flow intermittent to the flows, vasodilation, and blood flows to this capillary arm, side arm capillary, and supply this tissue. Ready? So there is an intermittent blood flow, closing, opening, closing, on opening. So this greater the oxygen depth, greater the oxygen deficiency, longer the intermittent blood flow, okay, longer duration, this capillary will remain open. Okay, and higher the blood flow. Now they have given one application. What happens in a beriberi deficiency of thiamine, niacin and riboflavin. And as you know from a biochemistry concept, these vitamins are necessary for oxygen induced phosphorylation. Okay, so they produce ATP. So if this vitamin are deficient, ATP is not formed, and ultimately ATP is required for the keeping up of muscle contraction. Muscle can't contract and they will be dilated, and ultimately vasodilation in the body in the beriberi. Okay? Now this acute metabolic control of local blood flow. Okay, now they have explained the reactive hyperemia and active hyperemia. Okay, so this is nothing. रिएक्शन मतलब आपको किसी ने कुछ गाली दिया और आपने रिएक्शन दिया, ठीक है। सो इट इज द एक्शन के सामने होता है रिएक्शन, और किसी ने कुछ नहीं किया और आप अपने से खुद से करते हैं, दैट इज एक्टिव। सो रिएक्टिव हाइपरेमिया इज व्हाट? हाइपरेमिया इन रिएक्शन टू द आर्टरी ऑक्लूजन, ठीक है। और एक्टिव हाइपरेमिया मतलब आप एक्सरसाइज कर रहे हैं और आपके मसल एक्टिव हो गए तो उसकी वजह से हाइपरेमिया होगा, दैट इज एन एक्टिव हाइपरेमिया, ठीक है। तो इसमें भी कुछ ज्यादा टाइम पास ही है कि यू ऑक्लूड ऑन आर्टरी, so in the tissue there will be oxygen depth, so ultimately because of this oxygen depth, और वहां पे मसल और सब तो काम तो कर रहे हैं, टिश्यू तो फंक्शनिंग कर रही है, नो डाउट आपने आर्टरी ऑक्लूड कर लिया, so ultimately there will be a lack of O2 and excess CO2 and express and lactic acid, so ultimately they will do vasodilation and this will be reactive hyperemia, and this muscle stimulation leads active hyperemia, okay, because when you are doing exercise you are just eating all the tissue fluid nutrition and in excessive quantity you are making the vasodilator substance, so ultimately increase blood flow, okay. In next session we will start from this autoregulation blood flow, we will learn the myogenic theory, we will in detail we will discuss the nitric oxide, okay, क्योंकि नाइट्रिक ऑक्साइड पे बहुत एमसीक्यू आते हैं, ठीक है।